Well, good morning and welcome to the Community Social Services Certificate of Recognition webinar. My name is Satvinder Basran and I am with the Community Social Services Health and Safety Association of BC. Before I begin, I'd like to acknowledge that I'm speaking to you from the territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I would like to acknowledge the territories and lands of the First Nations the speakers are presenting from today. And we would like to acknowledge the lands and the territories of the First Nations that you are all calling in to participate on this webinar. We're really pleased to announce, in partnership with the association and the BC Municipality Safety Association, for the first time having a core manual and a modified auditing software available for the community social services sector. This is a huge accomplishment. And I personally want to extend my kudos to everyone that contributed to this process and bringing it into being. Um, COR allows employers to assess their health and safety management plan and engages with staff to reduce injuries and accidents in the workplace. It improves workplace health and safety culture. Late last year, my board engaged in a strategic planning session. And our vision statement is well-being and safer spaces for all. And one of the strategic focus areas was to promote health and safety culture. And core, in my opinion, and the importance of having tools to help cultivate a health and safety culture is really a pillar within the core program that exists today through WorkSafe and facilitated through our partner, our authorized partner, the BCMSA. So with that, before we get into the presentation, just some housekeeping pieces. The webinar is being recorded for future reference, and yes, it will be on our YouTube channel for use, for accessibility for those who could not attend today. Um, this is, as to questions that you may have, please put them in the chat for us. And the hope is that once you go through the presentations, you'll have maybe some of your questions will be answered, but we will get to all of them at the end of the session. That being said, you're also welcome to respond to the survey that will be sent out to you. If you recall a question at that time, or even after, you can send a question via email to our organization, and we'd be delighted to follow up with you. Now, as to the presentations, please put your pens down. You don't need to write anything down. You will have access to the presentations on our website, and we'll ensure that you get that. And there will be a certificate of attendance that will be issued to all of the participants that are here today. Now, that being said, at our last session, I was informed that a number of organizations were broadcasting the session throughout their organizations. And so I encourage you to send the participants to us to Anna or the main email, and we'll ensure that those folks that actually took the time to be a part of this, that they are recognized for their time in this session. Now, to provide a context and a background to this webinar, a small working group was struck back in May 2023 to investigate, what can we do practically and realistically within the confines of the existing core structure to support our sector. And a small working group was struck. And I was very fortunate to have Bawa Viedzma, who was the chair of the committee. And on that committee, we had Justin Chahan, Liz Kim from the BCMSA, Peter Letts from the NIMO Association for Community Living, Mandy Rose from Milieu Children and Family Services Incorporated. She's here. Very fortunate to have her to be a part of this process. Nuno Jordo and Nicole Ricci from Success, and Farsad Kassad from the Health Sciences Association of BC, and with the impeccable support of Anna Mateos, who sort of supported the whole group in the background. I was not on the committee purposely, and they did a marvelous job, absolutely outstanding job. In conjunction to that, other organizations that were COR certified also contributed to the process, and I want to take a moment to thank them and express their contributions as well. And that is the Delta Society for Community Living, Aim High, Prince George Association for Community Living, Chilliwack Society for Community Living, and Axis Family Resources Limited as well. Now, you know, my hope is that sort of the outline of the webinar will be I'll be introducing the speakers, and then they will be presenting uh, after I introduce them all. And as you're participating in this, I'd like you to think about two questions that I like to pose to you, and you're most welcome to share them via chat. And that is, what is health and safety culture to you? And you can put that in the context to what it is framed to your organization. At the same time. The second question is, who leads health and safety? You know, who do you believe leads health and safety, and in what capacity? With that, I'm delighted to introduce the following presenters for this webinar. And I've had the pleasure of working with most of them for quite periods of time, and I'm very thankful that they are able to do this for us today. Uh, Bawa Vietzma is the Director of Human Resources and Labor Relations at Possibilities Association of BC. He has several certifications in HR, LR. He is from the Netherlands and brings a wealth of knowledge and experience in community social services. I've known him for 15 years. And I actually knew him before I took on the provincial purview about 8 years ago as an employer. And I can't speak highly enough of Bawa and his organization, and really taking leadership, walking the talk, if you will. And so, thank you, Bawa, for being here. And also, Bawa will be sort of facilitating this webinar as well in the background. Next is Justin Chauhan, Director of Programs and Initiatives at the BCMSA. Over the past 6 years, he has health and safety professional designation. He's worked in local governments, I believe City of Richmond and City of, forgot the other one, but I know it's another big Coquitlam. There you go. And I think you probably lived there too. He is a graduate from BCIT with a diploma in occupational health and safety, and holds a bachelor's of technology and environmental health. I can't again speak highly enough of Justin. He comes from the municipality industry. And so for him to really reach out and be supportive and be engaging with our sector has been outstanding. I mean, and so, this is one of the part of the supports and how we were able to get this done. And so, Justin, thank you for your leadership from the municipality association and really making this happen. And there's always challenges here and there, but we get there when we get there, and it's really great that we are there. So thank you, Justin, for being here. Next is Mandy Rhodes, Director of Health and Safety at Milieu Family Services Inc., and also serves on the Community Social Services Health and Safety Association Advisory Panel since 2001. And I've known Mandy for quite some time too, in my previous employer role and in this role as well. And what I really admire about her is her ability to bring practical, real world lenses in getting things done. And, that's fine. You can have a very full policies and procedures, but what does that mean at the end of the day? And I think that is something that really speaks volumes of her skills and her abilities and her contributions to this process as well. Her role will be in this session as sort of consult and providing feedback as we're going through this process, but she will be able to answer questions and whatnot. And finally, Farsad Kassad. I mean, I had the pleasure of just meeting with him and working with him just recently. He is the Senior Labor Relations Officer, Occupational Health and Safety at the Health Sciences Association of BC. He's also serves on the advisory panel at the association since March 2023. And he's very passionate about health and safety, extensive research in occupational health and safety, and has several designations. Has a lot of experience working in public and in the private sector in Canada. And so for Saad, in the limited time I've met and known you, very thankful for you and looking forward to the presentation that you're going to be presenting today. With that, I'm happy to hand this over to Bawa. And so Bawa will take it from here.
Thanks very much, Sat. I'm very happy to be here. Good morning, everyone, and have an opportunity, as Sat has asked me, to share with you some of our experience with the CORE program. And though it is our experience that I'll be sharing, I hope and trust it will be relevant for any organization that aspires to achieve the CORE designation. It's certainly been a very helpful process and tool for us, so I'm hoping that others will benefit from that as well. So I'll try and share my screen now. A second. To share here. Slideshow. Click some. There we go. Hope everybody can see this. So first of all, CORE, Sat has asked me to share a little bit about the working group that he referenced, where we looked at the audit tool, the CORE audit tool. And really the reason for that was CORE is administered by the BC Municipal Safety Association. So the audit tool was developed really with a municipality in mind. And obviously that's a very different organization from social services. And so our committee looked at changing some of the language in the audit tool so that it would become more tailored to health and safety in our sector. And so we looked at some different things. What we tried to achieve was, or what we had in mind was, when the auditor actually administers the audit, help the auditor to look for examples in the community's safety, in the community social services sector context. And so change some of the language around that. And then also, as the auditor asks employees questions during the audit, it will also help the employees to understand what the auditor is looking for. So we went through the audit in detail, the whole text of it, and came to some changes, some language that better fits the health and safety context that we're in. And we added some relevant examples to our sector, where the municipal sector is more about buildings and equipment and machinery. Of course, we work with people, and so we did quite a bit of work there to make those examples more relevant to situations where we support people and the health and safety scenarios around those. So I believe that the end result is going to be really helpful. I understand, and it was just finished, so from my understanding, there hasn't been an audit yet with an organization in our sector that has used the new tool, but I do trust it will be very helpful and will contribute to a successful CORE certification for organizations in our sector. So that's the audit tool. Next, we will get into, there we go. So the benefits of the CORE program that I've been asked to speak to. And, I think there's 5 main benefits that we as an organization have experienced with CORE. It helps us to identify gaps in our occupational health and safety program. It's contributed to a holistic approach of health and safety. It also promotes a health and safety culture within our organization. And Sad has asked you some questions around that, so it'll be interesting to see what comes out of that. It improves health and safety performance, and it also, last but not least, provides a discount on WorkSafe BC premiums. So I'll go into each of these benefits in a little bit more detail, and we'll work our way through them. Sorry about that. There we go. So first of all, CORE helps identify gaps in the OSH program. And, a gap analysis is a very important exercise in preparation of the first audit. For us, it's been about, well, more than 10 years now that we first achieved our COR. And when we were CARF accredited, and so we initially thought, well, we probably don't have to do much because CARF also has a health and safety component to it. But what we realized when we first started was that CARF covers, give or take around 70% of the core requirements, but core is much more comprehensive in health and safety. And so we did have to do quite a bit of work to address some of those gaps. And gaps existed in some of our policies and procedures where we did not necessarily have everything in place that core requires. An example was that we realized we needed to do some work on a health and safety program for contractors. So contractors that come to our work sites to do maintenance or repairs, there's a requirement there for orientation, health and safety orientation to our work sites. So that was an example of a policy and procedure that we had to work on. Also, the core audit will probe into, so you have your policies and your procedures and your guidelines, but on the work floor, do you actually follow those, right? So we realized we had some gaps there as well, where we were not necessarily following, for example, the incident investigation process to the T, where we realized some people were missing some training that they were supposed to have. So we had to work on some of those things. And then last but not least, it also helps to make sure that the JOSH committee, their mandate is correct and comprehensive, and it's given everything it needs to function well. And I believe Farzad in his presentation a little later on will go more into the JOSH committee. But those are some of the things that we worked on and in preparation of achieving COR. It's moving on. So one of the things that's really benefited us was going through COR is a very comprehensive analysis and assessment of your health and safety program. So we learned better to look through that lens of a holistic and comprehensive approach. And in that process, we realized, there are things that make our health and safety program successful that are not necessarily even spelled out in the core audit or the core requirements, but that do contribute to the success of your health and safety program and your ability to pass the core audit. And one example of that is communication. So, and this probably is especially true in a larger organization such as ours. But one of the things we looked into and needed to do some work was some of our work sites had really good health and safety practices and had kind of developed them on their own based on the work they were doing and what was effective for them. And what we realized is we needed to actually communicate that to other parts of the organization that could benefit from that as well. At the same token is if an accident happens in one of your work sites, may prompt to a potential risk causing incidents in other work sites as well. So any of the follow-up done to prevent a critical incident or an accident, are we also communicating the learnings from that to other work sites so that same thing doesn't happen over there? And then lastly, how do we ensure that relevant health and safety information and documentation is available everywhere? I can still remember the time, in our health and safety committee many years ago when we had stacks and stacks of paper coming in every month. And it was very challenging, almost impossible to get through all of those and to see what was going on in terms of health and safety in an organization. And so we were really happy the day that we implemented going completely paperless with health and safety in our organization. And now, we have all the information at our fingertips and can see what's going on and where we may need to focus our attention. So that's communication. A second factor is psychological health and safety. You can have a, on paper, very comprehensive and good health and safety program, but in the end, it needs to be executed on the work floor, right? And so are there factors that or barriers that prevent people from in the moment applying the protocols and the training that they've received in order to keep themselves safe? And the National Standard for Psychological Health and Safety helps with that. Looks into, are people able to, in the moment, do they have the presence of mind to respond to health and safety situations and keep themselves safe? And if not, what are some of those factors that may impede that? And so this national standard contains 30 psychosocial factors that impact an employee's ability to do their work effectively and productively. And so they also support core success. It could be issues like, do people feel supported in their workplace? Is their team supportive? Is their supervisor supportive? Do they get the resources that they need? Are there perhaps things in their personal lives that preoccupy them? And how, as an organization, can you support people in that? So all of those kinds of things are addressed by psychological health and safety components. And so I recommend for organizations to look into that aspect of health and safety as well, because it really supports core success as well. And then lastly, recruitment. Do we consider health and safety sufficiently in the suitability assessment of candidates? We at one point realized that we needed to pay more attention to resilience in candidates, because they do sometimes come into situations at work that are challenging, also from a health and safety perspective, and how to handle and mitigate risk. And so people need to have a certain level of resilience in order to be able to cope with those stressful situations. And so that was just an example for us where we, from a health and safety perspective, had to say, we need to make some changes and look for some more specific aptitudes and skills in people for during the recruitment process. So that's the holistic approach. COR also promotes a health and safety culture, and how we have seen that is, first of all, COR is an annual exercise. So it comes back every year. So every year employees need to focus on, their health and safety and the program, the health and safety program that we have and that they need to follow. And so it keeps the health and safety on the forefront of everybody's mind. Secondly, a comprehensive effort is made to keep and to achieve, first of all, and then maintain the COR certification. So, that communicates the importance and value an organization places on keeping everyone safe, and also that it's providing the resources to do so. And that in turn, motivates employees to contribute to a healthy and safe work environment when they see that the program in place is effective, and it gives them control over keeping themselves safe, and that really motivates people to contribute. And lastly, obviously, it's achieving COR is something to take pride in for everybody, because everybody contributes to it. It's not any one person who makes COR a success. It's every employee in the organization. And so to realize that, for people to be proud of upholding excellence in workplace health and safety, also contributes to a health and safety culture. So moving on, COR improves health and safety performance. When we first, or before we started with COR, our health and safety program was actually in a very difficult place. We had some very serious accidents that caused some serious physical, but also psychological injury to employees, also resulting in very significant claims costs. One in three of our reported incidents resulted in time loss. So a lot of these incidents were serious. And all of that was when we found ourselves, about 10 years ago now, because of those high claims costs, we found ourselves paying a 97% surcharge on our main classification unit for our WorkSafe BC premiums. So, we were not in a good place. And starting with COR got us on the road to recovery, but it's not a silver bullet or a quick fix. It did require years of sustained focus on quality improvement, on fixing things that were broken, and over time we saw gradually improvements to the point where we are now, and we now have a stable health and safety program, and I'll get back to that in a moment. But yeah, COR gives us sort of the path to go on, but it definitely it will take, depending on where your program is currently at, but it will take an ongoing focus to maintain and achieve an effective health and safety program. As I said, earlier, what it improves is having a comprehensive look at your program, not seeing things in isolation, but linking the dots. And that, by the way, is also what the COR auditor does. When they audit your work sites, they will go along and make sure that all these different things are in place and function well together. For example, if a workplace accident happens and you do an investigation, there's so many different things to look into to see what has all contributed to the incident. Was it was it training? Was it a workload issue? Was a proper risk assessment in place? Had things been discussed in the team? And so forth and so on. So it really, COR really helps you to focus on your program as a whole, and helps you to ensure a comprehensive health and safety program is in place. And I also already mentioned some of these things, but COR helps you identify gaps in your policies, procedures, protocols, and then makes recommendations for improvement. Also ensures legislative changes are checked for implementation. So, every year almost there are changes in health and safety legislation that impact your health and safety programs, and then need to be reflected in your policies and procedures and what have you. And the COR checks for that. And then, as said, it also checks for your practices. Do you practice what you preach, or practice what your policies and procedures say you should do? And if not, if some practices are lacking, then some recommendations again will come out of the audit. It also helped us to develop some key performance indicators, and to see how your health and safety program is doing. And those are really important because it helps to see trends, and if things start to go sideways in some aspect of your health and safety program, your indicators will flag that, and you're then able to intervene early before things get out of hand, and to correct things. For example, we at one point saw an uptick in our injuries, musculoskeletal injuries, and so we realized what we needed to do was actually develop some training, some ergonomics training for our staff, which we did, and made it mandatory for all our staff to take that training, and we saw a significant improvement after that in the rate of these types of injuries. So that's just one example of where an indicator prompted us to do something in response. And then again, also COR helps to establish and maintain an effective joint occupational health and safety committee, and make sure that they have all the resources and the people on the committee to monitor the health and safety, the effectiveness of the health and safety program. So, in our case, we have seen significant improvements in our health and safety performance. Um, we probably, our claims costs now are probably only about 25% of what they were before we adopted COR. So 10 years ago, our claims costs have gone down by about 75%. Which then obviously also resulted in lower WorkSafe BC premiums. So instead of the 90%, 97% surcharge that we had to pay back, in 2013, we now get a 24% discount in our main classification unit because of our drastically reduced claims costs. So that's a huge savings, obviously, because the payroll in that classification that we have there is quite high. So it has resulted in significant savings. It also improves risk control. So I mentioned, back in the day, 1 in 3 of our lost time accidents resulted in lost time. That's improved to 1 in 10. And so, the incidents still happen, and obviously it's important to always report. Also, if incidents are not serious, because it helps us to be proactive in mitigating and preventing risk. But what we found was, though incidents or near misses still happened that were reported, far fewer of them actually resulted in a serious incident where a person had to take time off work because they were injured. And then also it helps workers feeling safe. If your program is performing, well, and all the resources and tools are in place to keep workers safe, that has an impact. And in the last few years, we have our annual, probably like you do as well, we have an annual employee survey. And in the last number of years, over 97% of our staff say that their workplace is safe. So again, indicates the effectiveness of the health and safety program, and helps people to do their jobs without having to worry about their safety. And then lastly, COR provides a discount on WorkSafe BC premiums. So if you achieve your COR status, you will get a 10% discount on the WorkSafe BC premium base rates. And so, that's very welcome, because that money can then be spent on other things that are related to the work we do. What I have to say, though, is, I would recommend not to make that financial incentive the primary motivation to pursue COR. I really believe to reap the benefits from COR, the motivation should be to create and maintain a safe and healthy work environment for our employees, because that will make our team members feel supported and happy to give their best to make their organizations thrive. And that is really all what we all want. And the fact that we then also get a 10% discount obviously is a very welcome bonus to that as well. With that, I will stop sharing my screen, as this is the end of my presentation. Thank you all for listening, and feel free to put questions in the chat, and I hope this has helped you in learning more about COR.
Thank you, Bao. That was an excellent presentation. And, I knew you folks were like COR certified for about almost a decade. But what was really outstanding was your vision around, you're not doing it for the discount. What you're doing it is to really empower your staff to engage and for your organization to take leadership in this area. And the statistics you're speaking to actually blew me away. I had no idea. And so congratulations to you and possibilities over the years. And I do recall about 5 years ago, you were telling me about some of the trending that was going on. And you folks are a large organization. right? And
Mm,
so, these are significant cost savings that are generated. And sort of my sort of perspective is always with organizations that are achieve this is that reinvest those savings back into your health and safety.
absolutely. Yeah.
And I think that's something that's really critical in that process. So with that, thank you, Bawa. That was excellent. And so our next speaker is Justin. Justin.
Thank you, Sat, and thank you, Bala, for that great presentation. Bear with me just a sec here. I'm going to share my screen as well.